Let's go to our next guest, Yishai Knobel, CEO, co-founder of Helparound. Yashi, welcome to the show.
Hi, glad to be here.
All right, I'm glad you're here. All right, give us. I had a look at your website. I got a look at the background on your company. It's amazing what you're doing there. Let's back up a little bit to who you are, how you got into this, and then talk about Help Around, what it does. And I've got 1,000 questions for you once we get to that point.
All right, happy to be here. We started from the belief that that there's a population in the market and in the world of chronic patients whose conditions really affect the quality of life. And the notion of the smartphone going around with everyone brought us to think about type 1 diabetes. That's my background, where people just need to juggle a lot of supplies, insulin and test strips and glucagon, etc. It's really a big hassle, and every time I talk to someone who thinks they're busy, I tell them, you're not busy. People who don't have the chronic condition are not busy. We have a lot of spare time. So with the evolution of smartphones and as they came into our life, we thought, wouldn't it be wonderful if now, wherever I am, I would be able to reach out to similar patients around me and get help in case I get stuck. So fast forward a few years, and today we have tens of thousands of people with type 1 diabetes who are helping each other mainly with supplies. So I got stuck without test strips in a shopping mall, and I can go to Help Around Diabetes app and just post a question. Anyone nearby who's able to help with some test strips. Now, these are over-the-counter medications that there's absolutely no problem in sharing. So people are absolutely using that. Since then, we always assume that there will be a role for the brands and for the corporate players, but that's how it started, with the notion wherever I am, I can find help around me, patient to patient.
All right. So, is it only for diabetes, or does it work on the other illnesses that people would be able to socialize and speak to other patients about?
So we started from type 1 diabetes, which is, it's important to understand that type 1 is very different from type 2 diabetes.
Right.
Type 1 is more intense, it's more intensive. And once we put out the diabetes network out there, it followed immediately that many other conditions could benefit from this. So right now we are working on a project in several other conditions. We are in dialysis, believe it or not, where there's a lot of hassle for the patient, for the caregivers. We are about to enter several other conditions that we have yet to announce. But the important piece is that community support was the starting point, but it's definitely not the end point. We realize that community support is part of the general patient support programs that are out there provided by pharma companies and patient hubs, and patient support programs support about $76 billion in a category called specialty pharma. So that's a massive market that is all driven by these programs that are today very manual. And we realize that we just scraped the iceberg when we started with community support. That is part of the story. Right now, Helparound is much bigger in terms of what it provides for the patient. Community is one, patient education, patient reminders, chat support, there's a family panic button. All these things are part of the support that is so necessary for the patient to manage their everyday, and for the manufacturer of the therapy to get the patient on the therapy and make them succeed on the therapy.
All right, so we're talking patient support and also being able to monetize this through branding. Companies integrate themselves into what you're doing, and the fact that I thought that your company had a lot of growth potential, because not only do you have a large consumer base to go out to, but you've got a lot of brands that will be fighting to get in front of the patients to use their product. Am I on point there with you?
Yes, and we have at the same time we are focused on the point that is mostly neglected, which is the point after the prescription is provided. Before the prescription provided, you see the TV ads, ask your doctors about this, about that. When we're dealing with specialty pharma, which is the big ticket in the category in the drug industry today, after the prescription is provided, the process only starts. Then you need to what's called activate the patient, get what's called prior auth, get the insurance to cover it. Then you need to onboard the patient to the therapy, and then you got to retain them. So you got to realize that this process can take 2, 3, 4 months after the prescription has been provided, because the therapies are very personalized today. They target niche communities. They're much more expensive. Okay, but as a result, they need much more hand-holding in the process. They're much more complicated. So self-injections, for example, or dialysis, these are things that are not straightforward. It's not just a pill. And that's where we see an opportunity in helping brands bring their relatively manual patient support programs to the post-prescription phase. And what we do is two things, is take these patient support programs that are already out there, they're existing, the material is there, the content is there, the resources are there, they're just scattered all over the place. We streamline them, we consolidate them on the smartphone, and then we learn and respond to real-life behaviors of the patient, because the smartphone is basically a walking package of sensors. And we know whether the patient is not sleeping well at night because they're moving around. We know, whether someone is commuting or staying home for 3 days. And what I'm saying is common practices for, the Facebooks of the world. The opportunity here to do good and help and do business is to tailor these patient support programs and turn them into learning and responsive programs to fit every patient's lifestyle. And that's really the big news that we're bringing.
Well, I would think that the other part of your business is all the data that you're gathering from all of the different people that are using your app.
Yeah, absolutely. I mean, and of course, there's privacy that is being kept, and there's, we only aggregate the insights and the learnings, but this is how you can actually, for the first time, these medical brands can actually learn what their actual patients are doing. This is not market research. This is actually your patients. Are they doing better? What are their behaviors telling us? And can we improve the support that we provide them through these learnings? And that's a big opportunity.
Let's drill down on that point, the learning software. It anticipates the patient's needs, not just reacts to it. Is that what I'm getting?
Well, the patient comes into our app and basically signs up to the program. They say, okay, you know what, I'm here just for the community, or I'm actually a patient, an active patient. I have a prescription in hand. So they opt in and they say, yeah, I'm signing up to this patient support program provided by a pharmaceutical brand. Okay? At that point, the conversation starts that we are facilitating. We're facilitating a conversation between the patient and the brand and the patient support groups in the brand. And part of it is that we are continually seeing how the patient is using our system and how they're behaving. And then we are able to optimize what is offered to them. And that's the learning piece. And all that is done automatically. So if a patient leaves the house every morning at a certain hour, then we can predict that statistically they leave the house around 8:30 or 9. Then we can tailor the reminder to package their insulin on the way out based on that behavior. And that becomes more efficient and more effective and more helpful for the patient as well as for the company that made that insulin. And it's a win-win. Everybody wants to fit better into their lifestyle. And the patient has full control on whether they want that kind of reminder or they don't want kind of reminder. Do they want to share data or they're not? They have full control, and they were just, we're just there to benefit them if they want to enjoy this kind of service.
Is your app available to the general public now?
Yes. Specifically for type 1 diabetes, the app is available. Welcome to go to our website or to the App Store and search for Helparound. And what you'll find there is a thriving community of type 1 diabetes patients. We are in the process of rolling out one of our corporate partners in the field of diabetes. We also have a partnership with the home dialysis company. There is a big correlation, by the way, between diabetes and dialysis. About 50% of dialysis patients have diabetes. That's a primary indication. So it's available for the public, and we will be rolling out more and more programs for specific conditions in the next few months.
Okay. And is your company at a capital formation stage right now, or are you looking to generate your revenue streams or more capital to grow your business just from sales?
Oh, so we actually have more demand than we can support right now. So we will be starting to have conversations on some equity financing within the next couple of months, and that we are seeing a lot of demand. We need to support that demand. The platform needs to be developed further, and we will need more capital for that.
Okay, so introductions to capital formation people, investment bankers, angel funders, things of that nature. You're open to that as well.
Absolutely, and especially I got to say, people who want to do good and understand the world of patient support and specialty pharma, and understand the unique nature of specialty pharma. Specialty therapies are different from what we used to, and there's a market dynamic there that needs to be understood. And we'd be excited to speak to people who have deep understanding in the space, or are looking to learn more and understand the size of the opportunity.
I've got a couple of people I'm sure would love to talk with you. How can they reach out to you?
Reach out to me. Find my details on the website on Helparound, Yishai at helparound.co, and I'd be happy to speak with them.
Great. Yishai, thanks so much for being a guest on our show. Appreciate that. You'll be hearing from my friends.
Thank you so much for having me.
You're welcome. Yishai Knobel, CEO and co-founder, Helparound.co.